So a lot of the times when you're trying to lose weight on a special eating plan, you can have deficiencies that occur due to rapid weight loss, because some of that could be water loss, and with that becomes electrolytes. So I want to kind of tell you the 4 main electrolyte symptoms that you could have, and we're going to debug it. Okay, and rather than tell you the symptoms, I'm going to tell you the 4 elements and then the symptoms that could be created. And some of these overlap, so you just need to understand them. If the person has low calcium, they will typically get cramps in their calves, legs, and feet. They will also get irritable, right? So they can be irritable and get twitching. They call that tetany, where you're getting a little twitching like that. Chronic cough, that's a calcium deficiency. And even depression and sleeping problems. But realize that it could also not necessarily be a lack of calcium. It could be that your pH, your alkaline acid levels are off too, because if the body is more alkaline from drinking more alkaline water or having digestive problems or acid reflux or all those things which create an alkaline body, or adrenal issues which create an alkaline body, you can't absorb the calcium. The calcium plugs everything up. And it's low in the tissue, but it's high stuck around the joints and the arteries. So that's just kind of the deeper reason why you couldn't absorb calcium. But also, if your gallbladder or your digestion's not right, or constipation, you can't pull in the calcium. Calcium is transported with the fat-soluble vitamins, vitamin D3 and K2. So that could be another reason why the calcium is low. And that would explain why people take the calcium, don't feel any better. Okay? Number 2, low magnesium. Weak muscles, so you feel weaker, heavier when you're walking. Hyper-irritability, irregular heartbeat, your heart palpates. So a lot of times when you take calcium, it's automatically coming with magnesium, like a CalMag or a calcium magnesium supplement. That's totally fine. Just make sure that you never take calcium carbonate. That's bad. So that's magnesium, which could also affect your sleep. Low potassium. Potassium, fatigue, brain fog, like tired in the head. So here you start the weight loss program and you get tired in your head. Well, you need potassium. Where does that come from? Huge amounts of salads that you're probably not eating. Not bananas. Bananas don't have enough potassium. Cramping, that could also be in the calves or in the feet. Constipation. If you're actually doing an eating plan and then you basically start getting constipated, then you would better add potassium. Feeling nauseated, sugar cravings, those are all symptoms of a potassium deficiency. Low sodium. Well, let me come back to this potassium. If you go to the doctor and get your potassium checked and it shows normal, that doesn't really mean anything. 98% of all your potassium is inside the cell, not in the blood. So you would have to deplete a lot of potassium for it to show up in the blood, so you can't always go by blood. Low sodium. And the sodium is what people are afraid of and they're worried about and avoiding, and salt. But if you're low in sodium, you will get headaches, fatigue, appetite loss, nausea, fuzzy thinking. So it's not a bad thing to take more sodium if you have those things. So I found too, it could be brain fog or fuzziness in the head or tiredness in the head. So if some of these cross over, then go ahead and take all of them. But I like to you can take these as a supplement, but also you can take more vegetables, sea salt, and this basically, magnesium is in the leafy greens and calcium is in the dairy, like the cheese type products. Okay, so hope that helps, but that's the debug for the electrolytes.